do you want to tell us a little bit about you and like, you know, how you got in touch with, you know, Devin or anyone else at like, how did you find out about CHERP, locally grown power, and what do you like about it?
Okay. So I am an occupational therapist. I've been in the field for 25 years. I have been teaching occupational therapy for 22 years. And I'm in a place now where I am creating an occupational therapy doctorate program at the Claremont Colleges, specifically at Keck Graduate Institute.
Right.
And I have a real passion in my work for health and well-being, and really just finding unique ways that we can take our knowledge as occupational therapists and apply it to emerging practice areas, to community-based practice, to situations where there have been some injustices.
Right.
And I can talk more about kind of our view of justice a little bit later.
That would be amazing. Yeah.
Yeah. But you know, and I don't know how familiar you are with occupational therapy, so I'm going to give you my quick spiel of what it is that we do.
Can I ask you about something like what I know about occupational therapy, and then you can sort of build onto it? Like,
Sure.
So I have twins, 8-year-old. They were born as preemies, like micro preemies, right? And so for the first 18 months of their life, they had, you know, physical therapy for large motor skills and occupational therapy for fine motor skills.
Yes.
And what we are talking about here is a much more expansive view of occupational therapy that sort of goes beyond like, you know, what my exposure has been, but it's more about, you know, you're talking about personal health, nutrition, but also about like worker well-being and the overall like whole spectrum of life. So, you know, take it from there. Like, tell us.
Yeah,
like,
I love hearing your experience, because yeah, it's always wonderful when people have had some engagement with the profession, and I think I'll be able to fill in those gaps for you. Okay. So occupational therapy was founded in 1917, and in 1917, the word occupation did not mean your job. It was used as just everyday activity. So occupations were just any activity that people would do in their days, right? And so we as occupational therapists understand that people need to maximize their health and well-being through engaging in activity, right? And it is that activity is really the nexus of health and well-being in one's life. And so occupational therapists do work across the lifespan with those babies in the neonatal intensive care unit, understanding that even the premature baby is an occupational being and has a fundamental right to engage in occupations. And so we look at, so then we break down occupation and say, okay, what is needed for successful participation in occupation, right? And for those babies in the neonatal intensive care unit, it might be creating a splint for them, for, you know, for IVs that they might have. It might be modifying the environments that they are in so there isn't too much sensory stimulation, so they get to this place where they can regulate themselves better, right? Yeah. And we do have expertise in human development and understand that people need support sometimes to meet those developmental milestones when they're very, very young, so they will be able to participate in activities later in their lives, right? And so we do work on things like the use of your hands. Like if you think of almost any activity that you do throughout the day, you need to use your hands, right? And that's why occupational therapists can be certified hand therapists, but physical therapists can be too, but their focus more is on just the strengthening, you know, the range of motion. We do that, plus we look at what are we strengthening for, right? What does this person want to be able to do? You know, we are asking we are always asking the why question. You know, why are we going to rehabilitate this person? So the PT gets them walking, and we say, what are they walking to? What are they walking for? You know, what are they going to do with that walking in their lives to make their lives meaningful? And you know, give them a sense of self-efficacy and feel like they have some control over their lives, independence, satisfaction, all of those things. So engagement in human activity is relevant across the entire lifespan, right? And we understand that when people cannot successfully engage in activity, it leads to decreased mental health, decreased physical health, less connection with other people, inability to really experience meaning in their lives, so lower quality of life. And so because occupation or human activity is the center of our practice, we as a profession have been incredibly agile,
right,
in figuring out where can we do this work.
right.
And so over the last 100+ years, 103 years, we've been able to expand into all these practice areas. So we are in neonatal intensive care, in early intervention, in school settings, working with kids, in mental health settings, helping people who are depressed, anxious, psychotic to be able to engage in their activities. We work in rehabilitation centers when people have had an accident and they need to gain those tools to be able to engage in everyday life. And it's not just physical things that we work on. We work on sensory issues, we work on perception, we work on cognition, we work on emotional regulation, all of these other things. So in a nutshell, we are a very holistic profession, right?
Yeah.
So and then we go all across the lifespan to geriatrics, to end of life. And part of what we do too is we really understand that people also need activity as a preventive measure, right? You know, one of the, between 70 and 80% of doctor's visits and hospital visits are caused by chronic diseases that are largely preventable,
right,
with lifestyle, right?
Yeah.
So we also do lifestyle management, and we are really good at helping people think about their habits, their routines, their roles, how to put everything together and really engage in activities that are really just going to promote their health and well-being, whether that means looking at how a person sleeps, how they move their bodies, how they, you know, what they're eating, when they're eating, you know, how they connect with other people, how they manage their stress, how they avoid risky substances such as alcohol and tobacco and drugs. And all of those things that I just mentioned, those 6 things, those are fundamental, the pillars of lifestyle medicine. So I am currently getting, working on a board certification for myself professionally, to become a board certified lifestyle medicine professional. And that is the American College of Lifestyle Medicine was started by physicians, but has all the allied health professionals coming together saying, we think we have the answers to our healthcare problems, and it lies in lifestyle, right? It lies in lifestyle. So another thing that OTs do is we look at worker health, employee health, and we are very good at doing ergonomic assessments and understanding what happens in work environments and those contexts, and then how that influences worker health and well-being. So when Dr. Shelley Schuster is the president of KGI, and he knows Joe Lyons. And so I had a meeting, you know, last year, I believe, with Joe and Shelley, and Joe said, you know what, I think that Devin would like to talk with you. And so my first meeting with Devin, as you can see, I'm a talker. You don't have to give me much, and I will talk a lot. So Devin and I met for over an hour, and we just kind of brainstormed ideas about how OTs might be able to play a role in workforce development. And I just saw this is just a tremendous fit for what we can do as a profession. So the other thing that I alluded to earlier was this idea of justice. And within occupational therapy, you know, social justice is very important to us, but we get even a little more concise with it and talk about occupational justice. And that occupational justice is the idea that every human being has a fundamental right to engage in occupations or activities that promote their own health and well-being. And there are a lot of injustices around occupation. I mean, we're living in that right now with, you know, with really confronting racial inequity in this country. You know, if you are a Black male, you can't take a run necessarily and be safe in the way that you are if you're a white male.
Right, right.
Like there's, and we call this, you know, there's several different types of occupational injustices: occupational marginalization, occupational deprivation, where people they are deprived of being able to engage in occupations, occupational alienation, where people have occupations that they do, but they don't derive meaning from them.
Yeah.
So they might be underemployed, they might be, you know, there's occupational imbalance, which I think a lot of us live with.
Yeah.
You know, if we are overworked and there's just, I think a lot of us are experiencing both occupational deprivation right now, living through this pandemic, and occupational imbalance, where we're working and we are serving as teachers for our children and caregivers and all of these things, right?
Yeah.
So that's my spiel, and you can see, you can imagine when Devin talked to me, he was like, "Oh, okay, like there's a lot of things that we could do."
Yeah, no, it's I mean, I'll say just on that couple of notes. One, I mean, you know, my kids are doing great, but I don't know where they would be without the help of those therapists. So that early intervention was just a game changer, and it was fantastic. So, you know, I have like immense respect for, you know, therapists in that field. But also I've done some work with, you know, there's in Camarillo, right? Camarillo, California, like north. There's this art studio called, I forget the name, Kindle something. Okay. But I forget the name, but it's, I've done some, you know, work with them where they, you know, it's like an art studio for, you know, for people who are on the autism spectrum, or like, you know, have disabilities. And it's so interesting to see, like, you know, kind of I was just thinking about that while you were speaking, that, you know, some of these artists, right, they are artists, they have amazing imagination, they are just like, their art is like, you know, you just compare it, you know, it's at par with any other great artist. They just need a little bit help in, like, you know, expressing that art, right? And so that's, and since they get that help at that studio, they are like, those art pieces are just fantastic. So, you know, just something that just quickly came to my mind. So I want to know, like, in your ideal world, or from your perspective, right? Like, as you are working with CHERP locally grown power, like, what are some of the things that, you know, we should be considering, or like, you know, what would be your, you know, being a, you know, the first nonprofit solar panel factory, and also being a community engagement organization, right? What are some of the things that are important for you that we should be, you know, cultivating right from day one?
So I think really focusing in on worker health and well-being is really important. I would think that would be the first step, and something that we could do as occupational therapists is to provide the consultation to look at the ergonomics of workstations. Right, and our workstations being set up in a way that is not going to, you know, cause carpal tunnel or low back pain, or, you know, get people really tired out, you know. So I think just the ergonomics of workstations would be a logical place to start. I really like this holistic approach that CHERP is taking in thinking about the physical environment of the auditory, the visual environment of the factory, and involving artists in helping to create a very intentional space for the workers. I think that's incredibly important. Occupational therapy could help in just thinking about who are the workers as individuals and what might be some of the unique needs that each worker might have. And so in occupational therapy, while we can do population health and work in community health, we also work with individuals and understand that clients have very particular needs. They have unique life stories and histories and prior traumas for some people that may get in the way of being able to successfully hold down a job, right? And having occupational therapy providers in that context to work one-on-one with clients to really assess, okay, what are your capacities? What are areas of growth for you? What are the things that might get in the way of being able to successfully keep your job? And I really commend Devin and CHERP for understanding that, you know, really making this a full justice organization and thinking about, you know, employing people who are homeless or near homeless or, you know, have developmental delays or who are formerly incarcerated. Usually those workers might need some extra support, right? And an occupational therapist could do the assessment and say, okay, for this person, maybe this person is on the autism spectrum. Mm-hmm. So social skills are going to be a big factor there. Some of the sensory issues might be a big factor. You know, for a person who has a cognitive impairment, it might be, you know, learning how to break down tasks and providing education to, you know, managers at CHERP to say, okay, this is the best way to help this person be successful in communicating ideas and giving directions and that sort of thing, right? If someone has a physical disability, you know, what are the ways that we could adapt the work? And adaptation is a really big thing that we do within OT. Because a lot of times it's not that we can change the person's capacity, but what we can do is we can adapt activities and environments to help them be successful. Right. And so how might we, you know, we might make recommendations for adaptations that would then help this person be successful at work. And for, I think a lot of people, there can be so much frustration around being able to hold a job because they don't get that workforce development and support that they really deserve, and that could help them be successful. So do you see why I think OT is the right fit?
It's one, it's the right fit. Two, it's you know, something that has to be like an integral organic part of, like, you know, the organization as we are building it from ground up, as we are building it from day one. It has to be like something that has to be thought about in every aspect of the organization. So 100%.
Yeah. So the other thing is that we are trained healthcare providers. And so every occupational therapist knows medical diagnoses. So if someone came in and, you know, they had diabetes, if they had, had a spinal cord injury or had a traumatic brain injury in the past, or, you know, they have COPD, we understand those pathologies and know how to work with that, versus someone who is, you know, working as a coach or something like that. Like we have that healthcare background that really just gives us a level of expertise to understand the complexity that oftentimes can come with people presenting with, you know, hardships in life, plus a diagnosis, plus, you know, something else. So.
And it doesn't even like, so there's of course, like, you know, considerations for, you know, people who apply and come in and start working and what kind of, you know, backgrounds they've had. But also, you know, there are plans of having like specific programs, like you mentioned, for previously incarcerated people, or, you know, at-risk youth, or, you know, or people who are on, you know, who are differently abled in terms of like their developmental or physical disabilities and things like that. Mm-hmm. So, I mean, it's also great to think about some of the things that you're talking about, just while developing these programs for these different communities of people coming into the factory and being able to work at various stations, and like, what do we have to change? in terms of the overall factory environment, but also in terms of specific ergonomics for, stations and things like that.
Yeah, yeah.
Right.
So I'm in the position where I'm starting an academic program, but I don't have any faculty yet. I don't have any students yet. Our program is beginning in August of 2022. And I'm hoping that we can find ways to get enough support on this side of things to get things going. But long term, I would imagine like having a faculty member that could serve as a liaison to CHERP, right? I mean, in an ideal world, you guys would be able to hire a full-time OT that was just, there to help workers, or part-time, whatever that would look like. But if we had a faculty member that could serve as a liaison to CHERP, and we could have occupational therapy doctoral students come and create therapeutic relationships with the clients and work with them over the course of time, like that they're in their doctoral program. Every doctoral student also will be doing a doctoral capstone and internship, which is 14 weeks long. And I would imagine that if there were particular initiatives that CHERP wanted to work on, we could have a doctoral student that would be there full time for 14 weeks, and really, do aspects of program development or whatever that is. If you decided, we'd really like to work on employee health, and we'd love to have a program that looked at some of those pillars of lifestyle medicine, of sleep and movement and all of those things. Or we want a program around building stress resilience. That's where our doctoral students could come in and help create that for you,
right?
And do the education plus one-on-one meetings with workers that I think could really be so beneficial to the health and well-being of the workers at CHERP.
Right. So one other area that I wanted to just expand on, like you kind of, just touched upon it, which was the artist event that we did. And you said like, it's great that we are thinking about some of these things, and tell us a little more about that. Like what kind of got your attention? Why is it important in a factory environment? Like what does the data tell us? Like how can something like that help?
So I'm not all fresh up on my data, but I will tell you that, so my area of expertise within occupational therapy is looking at spirituality in everyday life. And I come from the perspective that spirituality does not equal religion, right? But spirituality is actually this deep experience of meaning that comes about by doing activities and being reflective and being intentional and really connecting with values. And if we think about spirituality from a secular perspective, experiencing beauty, experiencing awe, feeling connected in our work, being able to experience flow in our work, being able to really just live in that enhanced context, I think that makes a real difference in people's lives. I think beauty matters. Beauty matters so much. And it's something that I think in a factory environment, it's all about getting the work done, typically, and not really thinking about how to create opportunities for experiencing beauty, for experiencing awe, for tapping into the creativity of people, which I think creativity is really expression of the human spirit, right? So I would love, I know that you have these amazing artists that are setting up these contexts, but also just having periodic events where the workers could also make things,
right?
And also engage in this creation of beauty in the environment that they're in. This really matters. It matters in life, right? It's not just icing on the cake.
Yeah.
It really, there's a deep meaning to it.
Right. Absolutely. That's very beautiful. It's just makes so much sense. Yeah, absolutely. Was there anything from like, from that event, like when you heard anything that kind of caught your attention, piqued your interest?
So I think usually if people heard, oh, you're going to bring artists into the space, they would think just about visual artists, right? They're just like, oh, they're going to have painters that are going to have paintings or murals, right?
Nice.
And yes, you're doing that, but to have a light artist, to have an artist that works with sound, I mean, this is like so innovative. And you know, as occupational therapists, we understand the importance of sensory processing and the importance of sensory environments to people, and that you are finding different ways to engage the senses through art is really fantastic. So that has really stood out to me as being just like another layer of what that holistic approach is looking like at CHERP.
That's fantastic. I think I have asked most of the questions that I had, and we are close to 2:30. Melissa, if you have any more questions, and I don't know if you guys, like Dr. Christy and Melissa, if you have another 5 minutes to stick around.
I can do 5 more minutes. Yeah.
Okay. So Melissa, I don't know if you like, do you have any more questions that I did not cover?
No, actually, your questions were very comprehensive. The idea of one-on-one does seem to be a bit of a challenge in terms of what CHERP is trying to do. Do you see, like, what's the best path forward on staying continually up with what each individual comes in with?
Yeah, and that's where having some continuity over time of having occupational therapy at different touch points would be really helpful.
Right.
And it might be, you know, doing four sessions initially, and then doing check-ins monthly or bi-monthly after that, right? After after the plan gets established. I think what's going to be important is to really look at, because there's going to be a range of jobs available in the factory, right? So how can we look at the capacities and the interests of this particular worker and pair them best with the jobs that are available, right? And it can be just a few sessions. I mean, sometimes it can be just a consultation in one session of really, and just also it could help provide the CHERP staff with, like the more managerial staff with understanding, okay, these are going to be heads up. These are things that are going to be important to know about how to work with this particular worker. And I can tell you that, like, I'm not up on all the workforce laws and that sort of thing. So that would be something that would need to be figured out.
Yeah, that's sort of where my question was going. Like, is there a need for employee training as well?
Oh, 100%. We could just focus on employee training.
That's kind of, I was just
I mean,
double checking on that.
We could just like the staff, right? We could provide education on working with people with autism, working with people with developmental delay, working with people with cognitive impairment, working with someone who's had a head injury, working with someone who has a spinal cord injury. We could provide that education to the staff, so you just have a better understanding of, okay, this is how, this gives us some tools to kind of know what to look for. You know, these are what perceptual deficits look like and how that might manifest in the workplace. You know, how do you work with someone who's periodically depressed? How do you work with someone who, you know, has a lot of anxiety? What are some strategies that could be helpful there?
Before we go, let me just ask one quick question. Is there, like, you know, knowing what we are trying to do over here, and like, you know, like wanting to write about like the importance of occupational therapy and the fact that we are thinking about it, like, you know, right from the beginning, are there any resources that you would want Melissa to, you know, read, or any articles that you might have written, or any of your favorite articles that, you know, just you know,
I need to do some homework on that.
Sure, think about it, and
comes to mind. because occupational therapists definitely do work in community-based settings. And one of the places that we trace our roots is to the arts and crafts movement, you know, turn of the last century, which came out of the idea that there were people who were working in factories that were, and you know, the Industrial Revolution was really making people sick and unhappy and making them feel so separate from the meaning of work. Mm-hmm. That, you know, they, you know, the arts and crafts proponents were saying people need to engage in making things and experiencing beauty. And we kind of, we trace our roots to that, you know, to the humanization of work and the factory. And so it feels very true. It feels very true that we would want to be involved with something like this, right? But what I can do is I can look at some of the literature and find some things to send you that might be especially helpful.
Okay, that sounds great.
Do you have a target population that you're going for the workers, the employees who will be working in the factory?
I think that's like we have, like right now, as far as I know, so there's other departments within the organization that would have a better answer to your question. Right. I can relay that back to Devin to, you know, give you an answer. As far as I know, right now we are looking at a comprehensive sort of volunteer program, and then as far as hiring in the factory is going to be sometime in the new year. So I don't know if they have like really thought through, like, you know, all those workforce development programs that we have. That's sort of like, you know, in the pipeline, but I can't imagine they'll be on day one, you know?
Yeah. Absolutely. And part of it is going to be just jumping in and figuring out what is it that we need? Right. Where are those gaps? You know, where are employees struggling? Yeah.
All right. Do you have anything for any questions for us?
I don't. It's been a pleasure to talk with both of you.
Yeah, really nice to talk to you. Thank you so much for your time. And really, like, this was amazing knowledge, information for me too. I really enjoyed, you know, listening to your perspective and like really like, you know, being educated on like the world of occupational therapy, which is so much more expansive than what I had in my mind. So thanks.
Yeah. Well, I'm happy to do that.
All right.
All right.
Thank you so much, Dr. Chris.
Thank you so much.
Thanks, Melissa.
Yeah. Take care.
Bye.
All right.